Hi and welcome back. Now this video is on the persistent daytime sleepiness and tiredness symptoms that some people feel despite using CPAP. So the benefits from CPAP vary from person to person, and there's a vast number of reasons why. So this video is just going to outline some of those points for you. Now, some of these actual points I've extended on in other videos. So I've put the video descriptions below for you in case you're interested in going and having a look at those and getting more information. So the first one is the ineffective apnea control. So this is where you should, if you start to see, so some machines, you can actually see the AHI level on the machines in some of the more modern brands. You can also, there are apps that you can download. So for instance, the ResMed brand have an app that you can download for their machines, and you can actually have a look at those and see your AHI and your mask level and your mask sleep and everything every day. So if you start to see an increase in that AHI or you become symptomatic again, then your first protocol is to check with the CPAP provider to get them to look at your data. Now, this should be the first protocol. Now, occasionally you will have some CPAP users where the apnea is not controlled at an acceptable level. And there's, again, multiple reasons for this. So they vary, but a lot of the time it's inconsistent usage and the length of time you've spent on the CPAP device. But it's worthwhile checking to make sure that the pressure levels are correct. So make sure that they're adequate enough to hold open the airways, especially if you have been on CPAP for a long time and you may need a higher pressure requirement. It's called a pressure review. So, and again, I've done another video on that for you. Check the apnea control. So check that the AHI, which is your apnea hypopnea index, is actually within the acceptable range. So on the machine, it should be below 5. But you can also ask the provider to break it down for you as to how much of that is apnea and how much is hypopnea. Now, you may have an increase in the hypopnea, which isn't total collapse of the airway, but partial collapse, that actually may be caused because you're blocked in the nose or you've got a head cold at the time and that. So those things can actually have an effect on the apnea control. The other one is mask fit. So some people have that the seal isn't within the acceptable range. And if someone's been on it for a while, they can actually sleep through that. The noise doesn't trouble them, especially if they don't have a partner. So that mask sleep can cause a problem with breakthrough snoring, or it can also undermine the sleep quality. And lastly, you have the usage. So again, when you're first starting out on CPAP, your usage might be inconsistent, or it may only be like 2 hours one night, or it might only be 4 hours one night and 6 hours another and 2 hours another. And it's very hard to gauge the true control of apnea when it's inconsistent. Now, as you become more consistent on it and the usage becomes, it might even be consistently 4 hours every night, then you will start to get a true indication of the apnea reading. So if it's inconsistent, you may actually see that you won't feel the benefits as well as if you were using it more consistent. Okay, the next one is slow physiology changes. So the physiological response from the body varies between each individual. And again, I have done a full video on this and included it in the links in the description for you. So some CPAP users feel better within a few days, and they can see the physical changes in their actual appearance, whilst others become frustrated and they actually feel despondent because despite using their machine every night, they don't feel any different. So this can be true and lead to the actual physiological changes that need to take place over time. So again, as I said, I've done a full video on that. So the sleep patterns change and your physiology changes over time with CPAP use, and it could be that that just hasn't happened yet. So next is health conditions. Now, your overall health will impact the energy benefits that you feel from your CPAP, or the daytime benefits that you'll feel from your CPAP. So if I had a patient come in to me to start CPAP and I saw in their notes that they had a medical condition such as a heart attack, or they've had got a heart condition or diabetes, or they've had a stroke, then I would always give them a little bit of a heads up that they may not feel the daytime benefits as well as someone who did not have a medical condition. That medical condition has been damaged or has a compromised vital organ, can undermine how you feel during the day. Now, what I do want to emphasize here is that some people might interpret that as, well, why use CPAP? You know, as if it's not doing me any good. But I really, really, really want to emphasize here that it's even more important, or the fact that you have a medical condition makes it even more imperative that you use your CPAP. So you might have someone who has mild sleep apnea, but they've had a heart condition, or they've had a heart attack or something, then even with mild sleep apnea, they'll be prescribed CPAP to alleviate the apnea on the actual body and further exacerbating the condition. So the sleep apnea exacerbates, and in some circumstances can actually accelerate the severity of these conditions. So removing the apnea by using CPAP therapy allows the body to focus on regenerating and repairing during sleep, rather than fighting with the body and focusing on keeping you breathing. So again, I've gone into that in a lot more video, and the link is in the subscription. So next we have attitude and perception. So your general attitude will actually increase your success with CPAP therapy. Now, if you are starting on CPAP to appease your partner or your doctor, or you're an employee because you're worried about losing your job, then you may struggle with the little annoyances that can present in the early days of therapy. So the benefits you receive will happen a lot faster when you are treating your apnea for you, and your perception will change and attitude will change towards it. So that's just to keep that in mind, that it's always better if you do something for you. It's like starting a spouse or partner can nag you till the cows come home to actually lose weight or get fit, but until you decide to actually do it, then that's when you'll see the benefits. Okay, so next we have someone who is what we call asymptomatic. So some people come in and they've been diagnosed with moderate and severe OSA, or sleep apnea, and they don't have any symptoms of sleep apnea. So they have reasonable energy levels during the day and they cope very well. So these people have actually conditioned to how they feel, and they've built up a resilience, regardless of whether they're even aware that they've got the condition or not. They have learnt to live with their disorder, and these guys are usually harder to get onto CPAP because they can't see the physical benefits. So it would be the equivalent of going to the gym every day and working out and going there religiously and doing the work and not seeing results. Eventually you're going to feel deflated and frustrated, and a lot of these guys actually cease. Now, again, I want to emphasize that you are not on the CPAP for the benefits. Yes, it's fantastic if you do get it, but you're really on it to protect the body and have your oxygen and pulse rates recover to normal levels, because over time that is going to do damage. Okay, so it would be like running your car on 80% oil for a long period of time. Over time, you're going to damage the engine, and something eventually is going to break. so just keep that in mind. Okay, and then we've got inconsistent usage, and I actually touched on this before. So in the initial weeks, you may have some broken usage, and that's actually okay. So this is not uncommon, and it improves the more you persevere. So a good analogy for this is your mobile phone. If you only charge your mobile phone, say, to 20% or 50% of the night, then it's going to run out of charge a lot quicker the next day. It's not going to last the day. And if you charge it to 100%, then you will receive the full benefits of having that phone available for the full day the next day until you charge it again. Now, you can look at CPAP machine or CPAP usage as your personal charger. So the greater the percentage of the night you use it, the more energy you will feel during the day. So just be aware that inconsistent usage will affect the apnea control. So when you're reading the actual levels, you will see a variance there until it's consistent. So I touched on that in the first tip. Okay, next is poor sleep hygiene. So again, there will be another video on this one, but sleep hygiene is just setting up good, consistent sleep habits that improve your quality of life. And the reason to do this is that if you have a regular bedtime and a regular rise time, and keep it within sort of 15 minutes, half an hour each night, then you're going to actually give your body the best chance of setting your circadian rhythm, which means that when you're sleeping, your body's going to do the work to recover and regenerate and repair what it needs to do. So the sleep apnea will have affected that over the years, and so it may not have a consistency or a normal for your circadian rhythm. It might be totally out of whack. If you start CPAP and then keep consistent bedtime and a consistent rise time, you will see the benefits a lot faster. Okay, so that's it for this video. So as I said, I've put links below in the description with the extended versions of these, but I just wanted to touch on these just so that you can have a quick little squeeze on what's going on. Okay, thank you, and I hope that helps, and we'll see you in the next one. Thank you.